is that it's transmitted by the Egyptian mosquito that causes dengue. The dengue virus is caused by a virus that belongs to the Fidaridae family that has 4 types of dengue stereotypes. These include dengue 1, 2, 3, and 4. It is important to know these 4 stereotypes so they can help in the recovery and provide a lifelong immunity against stereotype 1 and 2. The Caribbean regions like the Bahamas and other tropical and subtropical regions are where dengue fever mostly occurs. The dengue virus is spread by Aedes aegypti, to the lesser extent by Aedes albopictus mosquito. Zika and chikungunya are the 2 most common viral illnesses conveyed by this insect. These are spread when a mosquito becomes contagious when it feeds on an infected human and injects the virus into another human. They lay their eggs in buckets, bowls, plate, and flower pot, which contains a large volume of water, urban areas that have stingy water. These regions are served as tertiary ground. Mosquito also lives in indoors and outdoor areas. This can lead to them biting during any time of the day, whether it's nighttime or daytime. Dengue fever first emerged in the 1970s when dengue 1 and 2 were found in Central America and Africa. While the 4 stereotypes were presented in Southeast Asia, by 2004 the geographical distribution of the 4 stereotypes circulate together in tropical and subtropical regions around the world.
Dengue fever symptoms can range from mild to severe. One of the first signs of infection is a fever of 104 degrees or above. It is often followed by body aches, joint and muscle pain, pain behind the eyes, nausea, vomiting, fatigue, or rashes on the skin. Symptoms usually last 2 to 7 days. If the disease continues to progress, symptoms can be severe and life-threatening. Dengue fever symptoms can be very similar to those of other diseases such as Zika, typhoid fever, malaria, or the flu, so it's important to get tested. Many CARICOM countries are taking extreme preventative measures to reduce the prevalence of dengue fever. The most effective way to reduce the mosquito population is proper disposal of containers that can store water and become a mosquito habitat for laying eggs. The community is encouraged to place wire meshes or screens on windows and doors. Proper water drainage systems must be available and cleaned regularly. Remember, my CARICOM brothers and sisters, prevention is key. The premature start of the hurricane season has created even more grounds for mosquito breeding due to climate change and deadly hurricanes becoming more prevalent. Methods of dengue fever prevention can become very costly for the government to maintain. The cost of medical treatment, vaccines, loss of wages and reimbursements for sick leaves can also be a burden on the government and families. Dengue fever outbreaks disproportionately affect persons of low socioeconomic status. Individuals with comorbidities such as diabetes, renal failure, hypertension, pregnant women are at greater risk of becoming hospitalized due to the severe symptoms of dengue fever. Increased hospitalizations place a great strain on the healthcare system. It also overworks our healthcare professionals and drains the country's resources. So let's work together to reduce the spread of dengue fever.
Dengue, also known as breakbone fever, is a viral infection that spreads from mosquitoes to people. It is more common in tropical and subtropical climates. The disease is caused by 4 dengue virus, DENV, serotypes DENV 1 to 4, belonging to the genus Flavivirus, family Flaviviridae, and is mainly transmitted by a female mosquito of the species Aedes aegypti. Emerging arbovirus transmitted by the same vector have been identified in the Americas, including a chikungunya, and Zika viruses. Most people who get dengue will not have symptoms, but for those who do, the most common symptoms are high fever, headache, body aches, nausea, and rash. Dengue fever is characterized by a range of symptoms, including a sudden fever, frequently reaching 105 degrees Fahrenheit and above, pain and discomfort behind the eyes along with muscles, joint, or bone pain, often accompanied by severe joint aches. Rash, a flat red rash that may develop 2 to 5 days after the onset of fever, followed by a secondary rash of raised bumps that can appear 3 to 6 days after fever's onset. Other symptoms are nausea and vomiting, homeostasis or blood in the stool, along with feelings of extreme fatigue or restlessness. Dengue fever can manifest as either mild or severe and is often misdiagnosed due to symptoms overlap with influenza and other viral infections. Dengue fever can have long-term effects on the body, including post-infectious symptoms. Some people experience depression. Dengue fever can elevate the risk of developing depressive disorders, anxiety, and sleep disorders. Cognitive impairment. Dengue fever can lead to cognitive impairment affecting the child's education, persistent joint and muscle pain, and individuals with deficiencies in specific muscle pain. Individuals with deficiencies in specific vitamins such as B12, D, and E may experience persistent joint and muscle pain following dengue fever. After recovering from dengue fever, an individual has long-term immunity to the specific type of virus that affects them, but not to the other 3 types of dengue fever virus. This indicates that an individual may contract one of the other 3 types of the virus again in the future. Local healthcare infrastructure for dengue fever includes reporting cases. All suspected cases for dengue fever must be reported to the local health department. Testing. Ensure availability of FDA-approved dengue tests for all patients with suspected dengue. Investigation. Health departments are required to investigate cases and outbreaks of dengue. Education. Health departments can provide the community with information on dengue prevention and mosquito control. Vector control. Health departments should implement vector control measures in response to an elevated risk of dengue. Outreach. Health departments can direct outreach efforts towards healthcare providers and populations identified as being a higher risk for dengue. Surveillance. Surveillance systems should incorporate early warning systems, environmental monitoring, and laboratory support. Clinical case management. There should be clinical case management for dengue fever. Risk communication. There should be effective risk communication and social mobilization. Training. Training courses are available to assist physicians in early recognition of dengue cases and in delivering prompt treatment. In the field of poverty research, dengue fever has been found to be linked with individuals of low socioeconomic status, modest income levels, and limited educational attainment. Inadequate waste collection and sewage in substandard housing conditions can heighten the risk of dengue infection. High population density can elevate the likelihood of dengue transmission. Urbanization can elevate the likelihood of dengue transmission, as the migration of individuals to urban centers can result in a heightened disease burden. Access to services presents obstacles by obtaining health and childhood services, thereby heightening the susceptibility to dengue. Inadequate sanitation can elevate the likelihood of dengue transmission. Insufficient water supply. Deforestation alters the availability of microhabitats for mosquitoes, potentially heightening the transmission risk of dengue fever. Various factors can influence the transmission of dengue, including climate, population growth, interregional migration, aging population, and the availability of active physicians.